Welcome to Live with Hillsdale Hospital. Today is Wednesday, March 25th, and we're coming to you live right here in our studio, Hillsdale Hospital, to bring you the latest happenings in your local hospital. And I'm excited today because, first of all, I haven't been in the studio in a hot minute. It's been a couple months, I believe, that I've had the privilege of being in here to introduce who I'm going to introduce today, but to be in here to introduce our new providers or services. I want to give a big shout out to Kirsten Newland, who is our marketing director. She has done a phenomenal job at taking over this responsibility. We're kind of tag teaming this, and she does a great job on the radio every week. I listen every week to make sure, and she does a phenomenal job with our guest interviewing. Great series that we've launched in many areas, but on our live events, it's always great to hear a different perspective about what's happening right in your own neighborhood. And so today, I'm excited because I'm going to introduce for the very first time to our community, Dr. Sharma. Now, we have a Dr. Sharma here. Okay. Dr. Sharma is a psychiatrist. This is not the same Dr. Sharma, I promise you. Dr. Sharma has been in general surgery for numerous years. We're going to let him tell his story here in just a minute. But I'm excited because not only am I back in the studio, but I'm back in the studio with an amazing provider, a gentleman. I've enjoyed working with you as we've hired you and onboarded you. Subsequently, we posted your announcement about coming, rave reviews on our Facebook, and the commentary that we received, overwhelming support of your arrival. You come from initially, recently, Coldwater, but I'm going to let you get into your story here in just a minute. So let's start with the basics. You're in healthcare, right? And I want our audience to learn a little bit about who you are as a person. We're going to talk about your practice. We're going to talk about the surgeries you do, but as a person, what motivated you to get into healthcare? You're a young guy, so you got many years ahead of you, but what motivated you? What was your driver? What brought you here?
Right. First of all, thank you for having me in
Yes.
here today. And thanks for the great response that we had. So talking about myself, I'm married, and we are blessed with two boys
Nice.
who keep us busy
Yeah.
and motivated in our lives.
Yeah. What are their ages?
Their ages are 5 and 14.
Oh, wow.
Yes.
Okay. So keeps you very busy.
Keeps us very, very busy.
Exactly.
I went to medical school in India.
Yeah.
And then completed a formal training in general surgery. It's called general surgery residency in the city of New York, and subsequently went on to do fellowships in laparoscopic minimally invasive surgery in India. And additionally, I also did a fellowship in bariatric and metabolic surgery in New Jersey. I really enjoy doing what I do for a living. And I've been a surgeon for past 12 years, doing a range of surgeries as we speak. Outside of the medical field, I'm a very simple person. I enjoy quality time with my family, friends, and visiting new places, exploring new things, and doing some fun stuff.
Yeah. Now, were your parents in medical, or what was your passion to get into medicine?
Yes, that's a great question. So my family really supported me in converting my enthusiasm for my arts and craft into a formal career in surgery. When I was little, I observed my family physician and realized that, taking care of the disease was very, very rewarding and truly a noble profession.
Mm-hmm.
And I always wanted to get into at least close to what my family physician was doing.
Yeah.
And I was told when I was little that I was quite creative in fixing things.
Yeah.
And, doing some good arts and craft stuff. So carrying over all those qualities and experiences, I embarked on this journey of a fascinating journey, I would say, of in the field of general surgery.
Now, general surgery is fascinating in general. I always love when we get a general surgeon on our podcast or a radio program or whatever it is, even a live, because it's everything. I mean, the specialty is everything. In rural medicine, general surgery looks much different, doesn't it, than it does in urban centers. Usually in urban centers, you end up, the general surgeon's only doing bariatric. He's only doing lappies. He's only doing, whatever it is. In your particular case, you're everything. And so why don't we talk a little bit about that if we could,
Right.
because you're fellowship trained in bariatrics, but you have a vast amount of experience
Right.
in general surgery. Let's start there. What does general surgery mean? What does it mean?
Right. To me, general surgery, I think, is, I mean, in fact, it's a subspecialty by itself these days. General surgeons, they can do anywhere from, removing an appendix, gallbladder, to doing some open surgeries and laparoscopic surgeries
Mhm.
in nutshell. I would say, as we discussed, that being a general surgeon, I'm a board certified general surgeon. I have some experience doing those surgeries, but additionally I would say the subspecialty passion that I have really lies in the art and precision of performing more advanced laparoscopic surgeries.
Yeah.
Which would be surgeries such as, but not really limited to, anti-reflux surgeries, which is surgeries for heartburn, a devising solution for weight loss surgeries, such as
Mhm.
doing gastric bypasses,
Yeah.
sleeve gastrectomies, and some
Yeah.
revision surgeries. And then, of course, a full spectrum of advanced laparoscopic procedures, which is removing appendix, advanced cases such as colon resection, small bowel resection, stomach resections, and fixing hernias.
Yeah. So let's talk a little bit about, and I know it wasn't part of any of our previous discussions or prep, but there's been a shift in bariatric surgery because of some new drugs that are out there. How's the industry changed in your last
Right.
12 years? What have you witnessed? What would you suggest to someone who is battling, just their challenge with their weight? Do we start them on the GLP-1s? What do we do? What is the recommendation?
Right. I think that's a great question. So these days, with all the advances on the medical side of weight loss medications, there is a notion that these weight loss medications are an easy solution
Yeah.
to a complex problem that we're dealing with. Obesity certainly is not a problem per se. I would imagine that this is like a chronic disease that we
Sure.
have been dealing with, and
Sure.
we're still learning new developments in and out. But with all the medications, what I would definitely say is medications would be an adjunct to surgery, just like what we have with oncology or even transplant surgery, where surgery is one part of the treatment,
Right.
but there are other treatment modalities to assist with,
Yeah.
with surgery.
Yeah.
So likewise, I would say, as we see the future, as the way I see it, I would say this is going to help with the bariatric surgery rather than come in the way and patient doing choosing some other lifestyle changes or medications per se. The medications, your question about whether we should start them on medications, I think it's a good idea for any individual who have difficulty with lifestyle changes and diet to lose weight. For those individuals, especially with body mass index greater than 30, I would recommend starting them on medications.
Yeah.
And also some of the individuals who we expect them to preoperatively lose some of the weight before bariatric surgery, I think it's a helpful tool for them to lose weight that way. And certainly for some of the groups that lose some weight post-operatively but have a recurrence, in those individuals, I would say that the weight loss medications would definitely
work.
help address that area.
Generally speaking, you require a patient to lose a certain portion of body mass before you do the surgery,
Right.
Correct?
Right.
And you're saying that use those for that reason. But we also know the side effects of those drugs, as well as we hear a lot of horror stories about people once they go off them, of how it gets worse for them. So that's why you would recommend more of a permanent fix. Now, let's talk about that permanent fix if we could, since you're fellowship trained in it. We once did stapling. Can you tell us, what does bariatric surgery look like today?
Right.
Is it sleeve? What is it?
Yes. So today, the world of bariatric surgery in itself has really, really changed and has become more precise than what it used to be. We have dealt with stapling and procedures that were more malabsorptive and had more complications. As of today, speaking as such about bariatric surgery, the complication rate has gone down tremendously. I would say anywhere in the range of, I would say, 1 to 2%.
Yeah.
Most of our surgeries are focused around sleeve gastrectomies. That's the most popular go-to surgery. within the field of bariatric
Right.
surgery.
So it's just a sleeve.
Just a sleeve gastrectomy, which
Okay.
is basically removing about 70 to 80% of the stomach and converting the stomach into a tubular looking
Yeah.
organ, then a wider organ.
Yeah.
So it works by restriction and also, also enables some metabolic changes,
Yeah.
hormonal changes, which helps lose weight. So that's one part,
Yeah.
and that's the most popular, I would say.
Okay.
And then there are other options such as gastric bypass, which is basically rerouting the GI tract and converting the stomach into a smaller pouch. It works by essentially by three mechanisms. One is malabsorption, restriction, and then again hormonal changes and metabolic changes in the long run. There are other options available also for more difficult patients, such as duodenal switch, SADIs, and biliopancreatic divisions. Biliopancreatic division and I would say gastric bands, they're not very popular. They are less than 1% of the surgeries that we perform.
So they are becoming less.
Yes, they become less and less. For the most part, about 60% of the procedures are sleeve gastrectomies. Remaining, I would say 25% is gastric bypass, revision surgeries, a combination of that.
Excellent. Last on this question
Yes.
is there's always a psychological impact of someone losing weight. And we work with an entire team. First of all, there's a process involved to even get authorized to have the surgery. It does require certain thresholds like percentage of body mass reduction before you can even qualify for the surgery. But also there needs to be a psychological assessment done as well, because someone shedding 200-300 pounds has an impact on their psyche as well as socialization. Because remember, we do associate food with good times and going out with family, and that's all restricted because we know that after post-surgical, a lot of our patients end up, applesauce and some things that are not as plentiful of going out to a buffet. So we work with psychologists and others. That's an important aspect, right?
Yes, absolutely.
And you've seen that work in your previous.
I've seen that work, and in fact, what I would add here is, as far as the diet, initially, of course, they started on portion control, smaller diets, more so liquids. But as time progresses, pretty much I've seen patients 3 years, 5 years down the line, they're pretty much on a healthy sort of regular diet as we speak. Of course, if they start eating fast food, chips, obviously that is not recommended. But otherwise, if you strictly follow healthy diet, I think that is good enough.
And work with your counselors. Good. All right, let's transition, because we talked about general surgery, which is everything. You're doing things in the OR, from assisting other general surgeons, which, by the way, we have two other general surgeons. We have Dr. Morgan and Dr. March. So you're assisting them, they're assisting you, you're doing your own, you're on call. But there's an important component of general surgery that happens in the office, because you do a lot in the office. You're moving bumps, you're moving lumps, you're removing warts, right? Talk to us about the difference, because going into the OR can be intimidating, scary, but you do a lot in the clinic. Tell us the types of things that you can do in the clinic.
Yeah, so the types of things that we restrict ourselves doing in the clinic would be, little things that are less complicated and would essentially need local anesthesia or, otherwise. But bigger things that would need sedation or general anesthesia or any other types of anesthesia, we would prefer doing them in the OR. So the things that we essentially do in the offices are excision of soft tissue masses, doing some biopsies, maybe ligating, I would say hemorrhoids, or even, taking care of some of the wounds that we do typically.
Yeah. Had a family member that went in, had a golf ball size, on their cheek. It was a mass, and lived with it for a very long time. Thought that he would have to go through general surgery in the OR, didn't want all that, but it was removed in the office.
Yes.
And we find that is, first of all, the most least expensive place for someone to have that done.
Absolutely.
Where do you see a patient who waits too long, where something could be done in the office? Do you ever see that, where you end up taking them in?
Yes, I've oftentimes seen that, especially with, for instance, with an external hemorrhoid that is so painful, and the patient has been waiting for days even to get an appointment with a general surgeon. In those situations, I've helped them in the office and pretty much excise those wounds and
Absolutely.
make them happy.
I know our time is escaping us very quickly, but I wanted to ask you your approach to patient care. I love it. I had the chance to interview several places you've been. Your patients love you. What is your approach to patient care? How would you define that?
Right. I would say my approach in general has been patient-centric, with focus on individual communication or personalized communication, and a combination of technical expertise with compassionate care.
Yeah.
I always believe in providing or tailoring unique surgical solutions based on clinical demands, situations, and preferences of the patients.
Well, it's going to be an exciting time. I'm
Thank you.
excited. We used to have 3 general surgeons, and then we went down to 2 general surgeons, and we were making that work, but due to the call coverage, which is tough
Yes.
in rural communities like Hillsdale, and the demand of call, which, it's taxing.
Mhm.
We find that in OB, we find that in general surgery, generally speaking, not so much in the other disciplines, but really in those 2 areas, because you're always on point, you're always on call. You'll get called in at 3 a.m. to remove, someone had a salmon bone stuck in their throat, right? Or you have some type of child that comes in with appendicitis, right? And so you're always on call, you're always on point. So having 3 general surgeons is something we've aspired. And now it's great that we have you, because we have 3. And we have a support team at the clinic that does a great job, pre-authorizations, getting patients scheduled for surgery, but getting into the office. Let's talk about that. You're seeing patients now, right?
Yes, absolutely.
Okay, so your schedule's open.
Very excited to be
Yeah,
here. Yes.
and we can find information about you on our website, hillsdalehospital.com. There'll be information about the types of surgeries that you engage in, which is pretty much general everything. We're going to be doing some work with you in proctorship, I know, and some work with Dr. March and Morgan with some scopes and other things, but that's not going to take long. We're going to get you through that, and then you're ready to go. And you actually had your first surgery here last night. How'd it go?
It went really well.
Very good.
And obviously a new place.
Yeah, so it's always
new
learning. Yeah,
it's always
where are the
learning curve.
restrooms?
Yes,
Where's
new-
the coffee?
Even to find a restroom. I think
Exactly.
yes.
Those are the important ones, but it's great. So, it's great to have you on board with us here at Hillsdale Hospital. We want this to be a long and, fruitful relationship. And we encourage you, our listeners, to reach out to us if you have general surgery needs. And again, it's everything, right? It is, you got a lump, you have a bump, to, you need a major surgery. We do it right here at Hillsdale Hospital, not only in general surgery, but in vascular surgery, from endovascular aneurysm repairs to Dr. Stockall in urology, doing some significant, very invasive surgical procedures that we're doing here now. An incredible amount of resources that we've poured in to Hillsdale Hospital and specialty care. General surgery is one of those. It's always been what we call the bread and butter of local hospitals. In the OR has been general surgery. But as we expand, we have other opportunities in other surgical intervention, whether it's neurosurgery now with Dr. Loganathan, whether it's Dr. Stockall, whether it's Dr. Alam in vascular surgery, really just providing that full continuum of care, including pediatric ENT. She's here doing surgical intervention. A lot of services now that we're doing beyond just a traditional general or orthopedics, but it's great to have you as part of the team. I'm going to ask our producer today, do we have any questions from the audience? You have successfully answered all the questions. If you're listening to this after our live event, if you have a question for any of us, Dr. Sharma included, please feel free to put it in the comment section. We'll get it over to him to get the question answered. If it's one for us, we'll certainly try our best to answer that question and get it back to you. We'd encourage you, if you're looking for a general surgeon, an opportunity to get in to see Dr. Sharma, you can do that at 517-437-5350. Hillsdalehospital.com, I think, /surgery is where you can go to find information about Dr. Sharma and how you can access our services in general surgery. Dr. Sharma, it's been great to have you here. I want to thank you. I want to thank our community for supporting Hillsdale Hospital and our services. It's so important. When you support our programs, when you come to the Hillsdale Hospital, the impact that we make back to our community is overwhelming. The contributions that we make financially to this community, second largest employer, hiring, the fiduciary responsibility we have to make sure that we reinvest those dollars back into our community. We're engaged in that each and every day. If you're looking for a way to volunteer, no more. Right here it is, Hillsdale Hospital. We have plenty of opportunities. If you're looking for a great team to join, and we made some major accolades and announcements were made earlier this year from U.S. News and World Report, you name it, progress we've made in all of our units at the hospital, Chartis, whatever it is, we're making significant progress. Our people love to work here. They tell us that. They tell our third-party evaluators that. If you're looking to join a winning team, go to hillsdalehospital.com. Under the tab Employment will be all of our job listings. And we have plenty. You can start your career today. And these careers, they can go for a lifetime because you start in at an entry-level position. We'll pay for your education to go to additional schooling and training. We're always hiring nurses. We're always promoting nurses. We're always hiring for specialty positions. We'd love to have you join our team. Look online if you're looking for a rewarding career. Look no further. You'll find it here. If you're looking for other ways to connect with us, well, there's plenty of ways to do that. We have our national podcast, Rural Health Today, in which we share current things that are happening across the country, not just in Hillsdale, but across the country, issues that we're tackling, from government financing to care quality models, you name it, we're tackling it. I'd encourage you, wherever you get your podcast, download Rural Health Today, subscribe, like us, give us questions, comments, suggestions on guests we should have. We'd love to hear that from you. Every week on the radio, you can hear about services just like this, and you'll hear today about the work that we're doing with Dr. Sharma. You have ample opportunity to connect with us on all those social media platforms. 92.1 every Friday, 102.5 Buzz, plenty of opportunity to hear about what's happening at your local hospital. But ultimately, none of this would be possible without you utilizing our services. I encourage you, please look back, if you haven't used Hillsdale Hospital, coming back home, utilizing these services and reaching out to one of the providers like this, and having the question, am I ready for surgery? Should I have surgery? Do your consultation, have a conversation, and then we'll take it from there. We'll fight with your insurance companies. We'll schedule the appointment that meets your needs. We'll schedule surgery that meets your scheduling needs. We'll take care of all of that. But just look to Hillsdale Hospital as a place where you can receive total continuum of your care. We'd love to hear more of your stories, so please feel free to write us, to comment on our Facebook post, ask us any question that you may have for this program or any program, and we'll get back to you. And until next time, remain Rural Health Strong. Thanks for joining us today.
Thank you.